This episode is presented by Lost Bell Wines. Rebranding from one of the oldest wineries in Nova Scotia, Lost Bell is bringing a new twist to classic wines.
The Lost Bell Rosé is sure to be your new go-to refresher with a gorgeous pink color and deliciously simple taste and finish. If rosé isn't your thing, their Saval or Baco Noir will be sure to thrill your taste buds.
All of their wines are handcrafted in Falmouth, Nova Scotia by their wonderful winemaker, Tony. Kick back and sip the flavors of the valley with Lost Bell Wines by Saint Fimi.
Welcome to the morning meeting with Sarah and Jess,
where the tea is hot, the wine is chilled, and no topic is off limits. Pull up a chair and join us. There is room for all of you here.
We won't limit seating, we'll just build a bigger table. Let's begin today's meeting.
Anna studied for 4 years at St. Mary's University in Halifax, Nova Scotia, where she received a Research Honors Bachelor of Science degree in biology. Her research was focused in molecular biology and genetics, sparking her interest in how we can affect our genetics and take our health into our own hands. Following her BSc, she continued her studies at the Canadian College of Naturopathic Medicine in Toronto, Ontario, and graduated in 2015. Anna believes that when we are feeling our best, we can achieve anything we want. Anna works with her patients to remove obstacles to health. Together, they decide on a treatment plan that is best for them and treat their health concerns using diet, botanical medicine, nutritional supplements, and lifestyle changes, and also focus on a plan to stay feeling our best and to prevent future illness. Anna has a special interest in hormonal concerns such as PMS, menopause, fertility, pregnancy and diabetes, as well as digestive concerns. She is also interested in pediatric conditions as well as pre- and postnatal care. Anna grew up on Cape Breton Island and tries to spend as much time on the ocean or lake as possible. She loves spending time outside with her husband Cohen, baby Graham, and their dog Angus. She also loves going to the gym, trying out new recipes in the kitchen, reading, and spending some quality time on her yoga mat. Anna is a licensed naturopathic doctor, a graduate of the Canadian College of Naturopathic Medicine, a member of the Nova Scotia Association of Naturopathic Doctors, the Canadian Association of Naturopathic Doctors, and the College of Naturopathic Doctors of Alberta. So there you go. Let's meet Anna.
This Mother's Day, give the gift of support to moms, babies, and families in need right here in Cape Breton. By giving the gift of support this Mother's Day, you'll be supporting the Mom and Baby TLC Fund at the Cape Breton Regional Hospital Foundation. On average, this fund disperses close to $20,000 per year to Cape Bretoners when they need it the most.
The Mom and Baby TLC Fund helps new moms and families each month by funding items like newborn care supplies and clothing items, diapers, car seats, meals, medications, travel costs for specialist appointments, and more. Last year, this fund dispersed more than $27,000 to those in need. Let's help them reach their fundraising goal of $10,000 to support this important cause and moms and babies right here in Cape Breton.
Visit www.cbgivewhereyoulive.ca to donate today.
Hi, Jess.
Hi, Sarah.
How are you?
Great.
Hi, Anna.
Hello.
Welcome to the morning meeting.
Thanks for having me.
We are so excited
Finally
you're here.
around the table. So is everybody else listening.
I was just going to say, and so is everybody else. Yeah. We've had guests and listeners all very excited that you were coming up on the calendar. People who knew we were recording with you. So we're very excited. Yeah, no,
exactly.
No one will listen to this episode.
Yes,
Don't worry
it's
about
fine.
it. Well, Dr. Anna Dantino, we want to know all about you and what you do and how you help people. And we know some people that you've helped who are just glowing about you always. And we can't wait to share the important work you do with everyone else. So why don't we start off by you telling us a little bit about naturopathic medicine, your road to get there?
All right.
What it is.
This is perfect because this is like my favorite question to answer.
Oh, good.
Because I feel like it's a tricky thing to define or kind of find the answer to if you're looking by yourself. So I'll kind of give you guys how I describe it. Go into a little detail because it's lengthy. I feel like some other types of medicine or healthcare, they can say like, oh, I'm a dermatologist and I treat skin conditions, and naturopathic medicine is like
It kind of
get
speaks for
ready. Yeah.
right.
Right.
So in naturopathic medicine, we combine the wisdom of nature with modern science and research so we can diagnose, treat, and manage pretty much all different types of health concerns. So that's kind of a mouthful, but basically we take a lot of time with our patients to get to know them and get to know exactly what's going on with them and their health. And from that, we can treat short-term or long-term health concerns. So not necessarily everything. So if you're having a heart attack, you're not going to come and see us.
Right.
But maybe after you have a heart attack, you might come and see us.
Right.
And so that's kind of what we do in our office. So we use a lot of different tools, and honestly, they can kind of change depending on the ND that you're seeing. So we all do things a little differently or kind of focus on some different things. But usually for most of us, it kind of looks like going through a really long question and answer period. So I like to call myself like the Riddler, because I usually for every one question someone asks me, I'll ask them like 10 more.
Right.
And then we'll use blood work or labs, or we'll do physical exams, kind of the things that you would usually see in like your family doctor's office, just so we make sure we get all the information that we need. And then from there, we kind of go through any adjustments to like the way, the person in front of us is eating and sleeping and exercising and managing their stress. And we might add in like supplements or herbs or botanicals, acupuncture protocols sometimes. So we're trained in a little, in some different like techniques and modalities and things like that. And then the other really big part of naturopathic medicine is that we really focus on, I would say we put a huge emphasis on prevention. And so this is kind of preventing, like it could be something acute. So if it's a short little quick viral illness, maybe we're preventing that from coming back. Or maybe if it's a chronic condition, we're preventing that from sort of like flaring again. And what I really like, I see a lot of women in my office. And so another thing we talk a lot about with prevention is like anything that runs in their family. So like how can we sort of prevent that from happening for you?
Wow. Yeah. That is amazing.
Kind of in a nutshell.
Yeah. What a good description though.
Is that all you do?
Yeah. Seriously.
Wow.
That's it.
It's really quick.
That's all you can fit in. You know what? When you were speaking, I was writing down terms so I wouldn't forget it. And then you said one of them at the end is what strikes me about it. One, it's so holistic, it seems. And two, it's proactive. I mean, we are so used to healthcare being reactionary. And I mean, I know it's systemic and there's all kinds of issues there, but what a nice change to hear of this like proactive approach and getting ahead of it and being preventative and holistic. And when you said like we take a lot of time with your patients or your clients and you're sitting and asking them lots of questions and having that conversation, I thought like, wow, that's the complete opposite of most experiences in the doctor's office where they have to, they only have so many time and they're so inundated with, patients, and you feel, sometimes I feel like I'm wasting their time. I have to be really sick to go because I don't want to waste anyone's time or take that time away from someone else. Right, Jess?
I thought the exact same thing. When she said that, I was like, whoa, like, that really spoke to me because like that's just not something that we're used to.
Right.
And, like, wow, you take the time to get to know your patient.
And
what
I
a
think
concept.
that's like, right. I think that's like the biggest thing people are surprised about too. Like a lot of times when they'll come in for like their first appointment, if they kind of call the office or email the office or whatever, they say like, you'll probably be there for like, 60 or 75 minutes. They're like, what?
Yeah.
So they're like, do I have to pay for parking?
Right.
So it's like longer than they think a lot of the time. And sometimes too, like I learn a ton. I can talk with the best of them, but I learn a ton because when people have the chance to actually talk about themselves, and there's no kids there, or they're by themselves, or sometimes if they go to the family doctor, they're like, here's what's happening with me. But then also like my son has eczema.
Right.
All this like cream or whatever. So sometimes it gets like shortened down even more. And I mean, that's great too, because sometimes, like family doctors don't mind doing that. And that's awesome. But sometimes it is nice to just like focus on yourself for a little while and be like, actually, here's like a couple other things that are bothering me
Yes.
too. That
Right.
might not be at the top of my list.
And
Yeah,
it's nice
for
that you're
sure.
creating that climate, right? Like they feel comfortable to do that because of the climate created in your office that is for them. And the focus is there and they know the time is for them. And
Yeah.
it's, very purposeful, very intentional.
Totally. Yeah.
Yeah, that's incredible. Can you tell us, like, what are some common misconceptions about naturopathic medicine? I mean, there has to be some that are out
There
there.
is for sure.
Lots
Yeah.
of memes or lots of jokes or, so
Oh,
like,
yeah.
what are the common
This is my other
misconceptions?
favorite question. I
Oh,
love it.
good. 2 for 2.
Yeah, you
Let's
guys
do
are
some
hitting the
myth
nail
busting.
on the head. Yeah. I find the biggest one that probably the biggest one people will say when they come to my office, they're like, oh, I wasn't expecting you to look like that. Like, I think there's like a little bit of like the hit. Like, I think they think I would be a burlap sack and Birkenstocks.
Wow.
Like,
Isn't that interesting?
Yeah.
I was just going to say, wait, we're okay with Birkenstocks though, right? I have 2 pairs.
Yeah. But I find sometimes they think like it's going to be very like crunchy granola, or like, get ready to eat vegan for the rest of your life and things like that if you go see her. Or the other thing is that we will like take all of like the joyful things out of your life away. So like no more coffee or things like that. It's like, no, never happens. So I find those are really common things. The other thing I think is that a lot of people don't really realize like how you're trained. So there's a lot of different like names that will sort of get confused with naturopathic doctor. And so I think sometimes when you like Google those terms, or if you're looking for someone, you can get some websites or practitioners or whatever popping up, and like it can get confusing. So I think the training's a little bit different. So with like registered naturopathic doctors, there's a website in Nova Scotia. You can go see us all. So that everybody has like the right credentials and training and a license and good standing and all of those things that hopefully you're doing with most healthcare professionals anyway. So whether that be like your pelvic floor physio or your acupuncturist or your family doctor or whoever, and even like your counselors. So whether that's like psychologists or like counseling social workers and things like that. So we have something very similar because we go to school for like 4 years after your undergrad. So sometimes I think people are like, oh, is that like a weekend course or like
gosh, come on. Yeah,
that happens a lot, I think.
That must be so infuriating for you. Like, hello, it's naturopathic doctor. It wasn't a weekend course.
Wow. It was just like a mail-in certificate.
Yeah. A pop quiz.
Yeah. So we are actually like a registered healthcare profession. So I think those are probably the biggest thing. Maybe the last one too is that we're like anti-medication. So this is another thing. I think people think like, oh, if I go see her, she's going to make me stop like my stomach pill. I get that a lot if people come in for acid reflux, but we don't take you off anything we didn't put you on. So that doesn't happen. So those are probably like the big ones, I think.
Yeah, those are good ones. I think that those are important ones to kind of highlight and debunk for people, right? Like make it clear what it is you do and how it is you are able to do it for people. Yeah, amazing.
We were looking, like Sarah and I were both saying like, oh my gosh, like even us, like we both follow you on Instagram and we are always saying how present you are on there and the research and information you share is so helpful, so meaningful. And we were both kind of like just in prep for this episode, like reviewing your website again, just to kind of, get more familiar. And we were like, oh my God, like there is so much that you do. Do you have any like specific areas of interest over another, or, can you talk about that a little bit? What's your fave?
So I think there's some things that like most naturopathic doctors will see in general, just specifically because of our training. So the biggest ones that kind of like jump into my brain are like digestive concerns. So we have a lot of training in nutrition. So I think that naturally we attract that population of people who like, whether they struggle with it and they're not sure why, or maybe they have some type of diagnosis. So maybe they have celiac disease or Crohn's or colitis or something.
Right.
So that those kind of conditions, I think pretty much will always sort of like sneak into your schedule or your population. The other one that's kind of similar as well is like burnout and anxiety. I
Oh,
would say.
interesting.
Yeah. So those
See, I knew I'd
usually-
need you after
Have you
this episode.
have you seen a spike in that recently, I wonder?
Oh my gosh.
Yeah.
Yes,
Wow.
big time. And then I treat a lot of women's health conditions. So hormonal stuff for sure. So I see a lot of PCOS or like polycystic ovary syndrome
Mhm.
and endometriosis. And then I treat a lot. Probably the biggest thing that I see in my office are fertility concerns. So whether that's in men or women, I see that a lot. And so that's like people who are naturally trying to get pregnant on their own, or maybe people who know that they're going for like assisted treatments, so IVF or IUI. So that's a huge part of my practice. And then I think because of that, I do see a lot of babies. So I see a lot of posts
Oh.
babies and breastfeeding, things like that. So that's really fun.
Oh, I didn't
Of
realize that was
What
like
a nice.
yeah, part of it.
Yeah. So sometimes
babies.
afterwards, yeah, we'll see lots of babies. So whether, they're the really super special, awesome IVF babies or whatever, they're all awesome.
Right.
Of course.
And then the other thing I will usually tell people is like basically wherever you are on the period spectrum, I'll see that too. So I see a lot of younger women and girls kind of like figuring out what's happening with periods and period pain and regulating cycles. And I see a ton of women who are going through kind of like that perimenopause period as well, which is kind of like the second coming of PMS.
Right. Like how rude. We've
I
already
know.
been
It's
through it
not
once. Come
fair.
on, world.
I know.
Like, come
I
on.
know.
Let's
That's
since
a
you just
broad.
I
That's
know.
a lot of really interesting areas that I don't think a lot of people would probably know that you would do, right?
No.
Unless you know of a friend who's gone, or
Yeah.
like
I just think
like
of
when you
all,
sorry, go ahead.
Sorry, I just think of all the people you help, like all of those
Mhm.
people who are in such vulnerable positions in one way or another, or like really, I don't want to say concerning, but fragile states sometimes, or really
totally.
concerning states. Like all I can think of is, wow, you're helping so many people on so many different ends of those experiences, right? Like the varying cycles of it all. It's incredible.
Like for me, when I think
interesting.
of like before all this, but thinking of a naturopathic doctor, I thought it was people who want to forgo medication and go a more natural route. I didn't realize there was all a million other layers to it.
Right.
Oh yeah.
Like incredible.
And I feel like it's like I'm the oldest kid in my family, so like the self-proclaimed control freak,
right?
But it's a lot of people in those like vulnerable positions, like going through those diagnoses and things like that, and they're like, okay, I need to have control over at least part of this.
Yes,
like,
right.
Can I do what am I doing already at home, and maybe I could just make like some adjustments to help with that or improve my chances of feeling better, getting better, getting pregnant, whatever it is.
Yeah.
And so sometimes in those like chaotic times of like IVF treatments or surgeries or things like that, it's nice to know that you're controlling at least some of the things you can control.
Yes,
definitely.
Which is also very empowering for me to watch people do. So I feel like very privileged to be able to do that because it's pretty impressive.
That's incredible. What a gift you're giving people in order to like maintain some of that control, right? Because that's the scariest part of these experiences. Like
definitely.
You are not in control and we want to be so badly.
Yeah.
So giving people like a little corner of control in some way, like that is such a special gift. That's incredible. I know we'll get to fertility in a moment because it is one of your passion areas and areas of interest. And we know people that you've helped so amazingly with that. You ended there in your areas though on PMS, and PMS is something we joke about a lot, right? We're women, people joke about it, other non-women joke, everyone jokes about it. We've all been there. We've been on either end of it, right? Making the jokes or on the butt end of those jokes or whatever. But in all seriousness, like what is really happening when women are experiencing this? Like, how can we help ourselves manage PMS in a way that actually helps us and not in a way that just like minimizes it or makes us feel like a part of the joke, right?
Because it is tough too. I feel like even as like being 33 and having my like period for however long, like sometimes it still catches you off guard. You're like, oh, that's why I was crying in my car this morning.
Yes,
Or, like,
exactly.
whatever. And it's like at this point, it probably should be automatic to be like, duh.
Yes.
But it still gets you like every time. Or
That's
you're
right.
in denial.
It's like
true.
and I'm on the last block of my chocolate bar and I'm like, oh, right.
Here we go. Yeah,
That's why I wanted 18 of these this week. Like, got it.
Yeah. Or yeah, that's why I'm sitting in the Sobeys parking lot eating like a family size bag of like Lay's chips alone, like before I can go home.
I don't want to share with anybody.
Yeah.
Yes.
No, like no one is getting these.
Yeah.
Yeah. So PMS, most of us go through. I usually will chat with pretty much everybody in my office about this because there's kind of two parts of it. So it is like just a normal shift in hormones sort of at the end of your cycle. So when like the second half of your cycle is winding down and the first half's about to ramp back up, that's usually when we get the symptoms. So it's kind of like that shift in estrogen and progesterone, but it actually like shouldn't really interfere with like your day-to-day life. So like, if you're crying at like a cute cat video on like Facebook, that's probably okay. Or like,
right,
get some more cravings and those kinds of things. Or you get like a really cute card in the mail and it makes you tear up or something. Those are all normal, but there are some people who will experience it like quite a bit more intense than that.
Right.
And we'll
like
oftentimes
rage.
call that like, yeah, exactly. Like PMDD is what we kind of call that. So I always like to make sure that that's not what people are experiencing. So these are like people who are like, I'm going to divorce my husband every single month. And I get so close, I like call the lawyer and drop the papers.
Right.
Or
right.
like, it's not like, oh my God, his breathing is just making me want to like smother him at night.
Right.
Or
It's
sometimes
more serious.
And sometimes people will actually say like, I feel depressed. I feel like I'm depressed, or like their shifts in mood can get like really severe. And the other thing that will happen kind of for some people in that period of time is a lot of like really hard like period symptoms to deal with. So like if you get a little bit of period pain, like so some cramps that, you know, in the middle of the day at work, you're like, okay, that's uncomfortable, but you're not going to go home. But if you like miss work every month, or like you have to take like quite a few like over the counter medications or even need prescription pain medications, sometimes that's actually not normal. So it's common, but it's not normal. So that's something that should be like looked into a little bit further. So I always like to kind of like suss out like exactly what it is for people. Because there are things that we do just like everyday run of the mill that actually can affect it. So one of the things I think sometimes we're like thinking is helping, but is definitely not, is alcohol. So a little bit moderate. Drinking is fine. There's no kind of correlation to increased risk of like severe PMS symptoms, but like heavy drinking increases your odds by like 80% of having severe PMS symptoms. Yeah. So
amongst a million other things.
100%. And if you come home from work and you're like, okay, I need a glass of wine. That's one thing, but like maybe not like the whole bottle, and maybe not like, you know, like 3 days in a row.
Right.
That we kind of get a little bit worried about. The other thing too that I see a lot and I find helps a lot is oftentimes people are under fueling. So they're actually not eating enough. And that makes it worse too.
Interesting.
Yeah. And sometimes for people who do get a lot of pain, they don't want to eat. They literally want to go upstairs and like get in fetal position with like a hot water bottle, naproxen, and like call it a day. But actually, not eating, and especially like in the later part of your cycle, when you're kind of ramping up for PMS time, if you are really eating less in the like that week leading up to it, that can actually make it a bit worse as well.
Wow. Why is that? What's
big thing? is carbs.
Well, the appetite changes too, though. Like I find it's hard to tell now because I have the Nexplanon implant.
Yep.
So I'm just trying to figure out what PMS is for me now, like because it's new.
It's new,
But
yeah.
like it's like a new thing all over. But yeah, like previous to that though, and previous to the IUD that I had, I would know when my period was coming because my appetite would decrease.
Yeah.
So, but that's actually not helpful.
Yeah, exactly. And the other thing too is like in this, like leading up to PMS, like you actually want to eat more carbs. So like, eating more carbs has been shown to be helpful. And whereas I feel like a lot of times, especially as women and with diet culture and things like that's the opposite of what you ever hear.
That is so true.
Yeah. And so sometimes we're not really setting ourselves up for like success during that time. The other thing too is if we're not getting enough fiber. So, and this sometimes can help with like for people who in the PMS kind of window will get period poops.
Yes.
Get like
that is the thing.
Digestive stuff.
Oh yeah.
Definitely.
Yeah. So like a little bit more fiber helps with that. So whether that's like taking some extra like vegetable, like chopped up veggies for like a snack at work, or like even if you're like a smoothie person, even just like throwing a little bit of psyllium or flaxseed or whatever in there. Like it doesn't have to be a lot, but that makes a big difference too.
So interesting.
Yeah.
So there is a correlation to that. Like why does that happen? What's the...
Basically what happens when your period has to start is you need a little bit of inflammation because your uterine lining is shedding. So we need a little bit of inflammation to kind of like light the fire to get that started. And in your pelvis, which most of us have seen like the anatomy book from like grade 10 biology or whatever on the pelvis in like the doctor's office, everything's kind of like smushed in there. Like there's a lot of stuff in there. It's not very big. So the bottom part of your like bowel is actually touching your uterus. So what happens is a little bit of those like inflammatory markers will actually kind of like seep into the wall and will just cause like some irritation in the lower part of your bowel and give you like changes in your stool. So for a lot of people, it ends up that they're like pooping more, or it's like uncomfortable and not typical. But for some people, it actually can't even make them constipated too.
Very
so it depends on the person.
We go through way too much. Like way too much.
I know.
But like are so undereducated about it really, right? Like
totally.
It's unbelievable. And I know you touched on that. Like we don't really know like PMS, PMDD, and is DD depressive disorder, or what is that?
Dysphoric disorder, but
Dysphoric disorder.
Sometimes they get used interchangeably. Yeah.
But like how many of us are just like, well, it is what it is.
Yeah.
Like,
well, that's what I mean. We
for our whole lives. So
yeah.
Yeah. I think of like grade, like, I don't know, 8 health class or whatever, when you like saw like the picture of like your menstrual cycle and like the egg and the sperm. And like, it was like, never have unprotected sex.
Yeah.
Still get pregnant.
Exactly.
Your period is always 28 days long. And
yes.
Like, now that you're an adult, you're like, that's actually none of
that tracks actually. Yeah. That is so true. There's very little education about it. And I know we've chatted about this on different episodes, but it's just so interesting because women's health seems like so utterly underexplored, and it's like up to us to figure it out, right? Like we have to advocate for ourselves because even in like general medicine, like our GPs maybe don't have a ton of training in it. Like it's just so, it just like,
and some of the things we know now, we probably wouldn't have known that necessarily. So even like some of the things I see a lot in my office are like PCOS or endometriosis, where those are a bit newer, not necessarily newer diagnoses. We just know a lot more about them now. So sometimes for people who have like older GPs, they're getting a referral to a gynecologist, which is amazing. That's where they need to go.
Right.
These are the most educated people on that, but it can take like 18 months.
Right.
Well, when I think of anyone that has shared that they have been diagnosed with endometriosis, the journey to get there has been like painfully drawn out, test after test, advocating for themselves. Nobody believes them. Everyone thinks they're crazy. Like that's what I hear when people talk about that diagnosis.
Yeah,
It's interesting that you say that.
Their pain, like it just, we've been taught to kind of minimize that pain, right? Like, oh, it's your period. Like, get over it.
Or that it's normal.
Live with it. Yes, it's normal. That's
and
what
you
people
shouldn't
feel.
you should never miss school or work. And like I had friends like all through like junior high, high school, whatever, whenever we were kind of figuring out our cycles, and they literally would have to go home, or they would just not come to school because they were in like so much pain. But it was just like period pain. But it shouldn't, again, like you can be aware of your uterus and like it is getting inflamed and contracting, get some stuff out. So like it's going to be uncomfortable, but it shouldn't be like, you shouldn't have to quit your job because exactly. Because you've like a week of the month where you literally can't.
Right.
Wow. It's nice to hear that there is more, I assume, like research in these areas and people are paying more attention and doing more work in it. Like it's so nice to hear that and know that. I'm going to assume it's women, but I don't know that for sure. But I like to think that maybe there's like, we're seeing a shift in healthcare focus when we see a shift in who's entering that realm. So that's very, cool. You know, it's reassuring, I guess, to hear that and to know. But it is, I think, important to have these chats because otherwise you would just, again, assume it was normal, minimize it, make it not a big deal, live through it, like learn to
not realizing that there's things we can do to make our lives more enjoyable.
I like how you said it's common but not normal, right? Like many people may experience, but it doesn't mean you should be in pain. Yeah.
And now too, there's like a little bit of research talking about like people who go through like unexplained infertility. So if they're trying for a really long time to have a baby and, you know, like all of their hormones are coming back normal, all their lab work, their partners, like investigations are all coming back normal, they're finding that a pretty high percentage of them actually have like undiagnosed endometriosis. So like 47%.
Whoa, that's a lot.
Yeah. So sometimes for people, it can almost be like silent or like they don't necessarily experience like the extreme pain that other people do, but they still, when they get in there and kind of look around, they still have like the signs of it and stuff.
Wow.
Which is wild.
Maybe we can lead that into fertility and the work you do with male and female fertility. But so with endometriosis, can you say it?
Endometriosis.
Yeah, thank you. I just lost the word.
Endometriosis is a thing though. So
okay. That was
I
didn't say that on purpose, but sure. With that, that impacts fertility. Why? Like, why could that impact person's opportunity to get pregnant or chance?
So there's a couple of reasons. So basically what it is like we all have an endometrium. So it's essentially one of the layers of the lining of our uterus. But what happens with endometriosis is that tissue is like growing somewhere else in your body. So like there's some pretty extreme cases of it. There's a couple really cool Instagram accounts, and I can even give them to you guys in case you want to like post them in the notes or whatever.
We'll put them in the show notes.
Yeah.
For sure.
Of some really super inspiring women in Nova Scotia that live with endometriosis. And some of them have had this endometrial tissue show up in crazy places. So like on their lungs, in their eyes, like very bizarre things that are obviously going to give them symptoms that have nothing to do with their period. But most commonly what can happen is it can actually grow like in your pelvis, in your abdomen, on the outside of your uterus, on your bowel, on your bladder. So sometimes it can give you symptoms that might look like IBS or irritable bowel syndrome. But if the tissue is like attached to your ovaries, for instance, or the outside of your uterus, it can affect the chances of an embryo being able to kind of implant where it needs to implant for you to get pregnant.
Right.
So because basically it's going to respond to hormones just like it would if it was in your uterus, but it's outside. So yeah, it can cause it's pesky tissue, that stuff. So a lot of times depending on how severe it is, it might need to be removed actually before people try to get pregnant or go through like an assisted like cycle. So IVF or something like that. Yeah. So typically is going to affect implantation when people are getting pregnant, or like that embryo actually.
Wow. Yeah.
And you can get pregnant naturally with it. Lots of people do, but it is a common reason for.
And you kind of need to to be aware of it.
You need to
Knowledge is
know, yeah.
power. Like you need to know you have it.
But
yeah.
this is likely when people find out, like you were saying, like people find out that they have this when they do start
They're
trying family planning and they're hitting roadblocks.
And it can take, based off of because the main symptom for it is pain. So if you have a normal amount of pain by just having that tissue just in your uterus, they have oftentimes extreme pain because it's growing in so many other places. And so there was a study done in looking at endometriosis diagnosis in Canada, and they found it was taking an average of 10 years for women to be diagnosed with it.
Holy smokes.
So it can be, I think it's getting a lot better. I think a lot of practitioners are a lot more aware of it. And I know in Halifax here, we're actually in the next 2 years, they're opening an endometriosis clinic at the hospital.
Oh, wow.
Just these, specializing in that, which is really awesome.
Yeah, that's amazing.
I think there'll be more resources and things like that. So people will be able to sort of find out earlier and stuff.
Right. Is there a demographic that usually falls into that age range wise? Like, is it when you start to have your period, can you have it then, or does it typically grow over time? Oh, you can have it right away.
You can have it then. Yeah. So a lot of times in younger women, they're noticing the pain more often. Sometimes when it comes to family planning or trying to get pregnant, if it's sort of a lower grade or there's not quite as much, they might not have as much pain, so they might not necessarily know, and so it more seems to pop up there as well. And so the tissue can be removed if it's severe enough, but it also there's a very good chance it will come back.
Wow.
Yeah, so they could have to have it removed a couple times.
So interesting. So for the male and female fertility, I was thinking of it in terms of natural solutions, but now I see that maybe that's the wrong terminology. Is it more so support? What can you tell us about your role in helping people with that fertility journey?
So when I was in naturopathic school and a long time ago, I was on a shift in my clinical, my last 2 clinical years at school, where it was just a fertility focus shift. We worked really closely with some fertility clinics there, and it's a little bit different than how things work here. We only have one fertility clinic for all of Nova Scotia, but I went to school in Toronto, and there was one on every block. So
wow,
there was a lot more, and it was awesome. And I was well, when I graduate, I probably won't see very much of this at home and then foot in mouth, because I see all kinds. But so it kind of depends. So a lot of times I will see people early on who maybe just want to make sure, okay, we're thinking about having a baby in the next little while. I want to make sure I'm getting the right nutrition and a good prenatal and those kinds of things. Lots of people who are really proactive, which is awesome. Or maybe they went off birth control and they've been trying for a couple months and they're starting to track their cycle. So different parts of their cycle. So whether that's how long it is and how long their period lasts and those types of things, or there's some people will track, cervical changes in their cervical fluid and those types of things. So I do see a lot of that when people are just trying to get comfortable to figure out what they're looking for and how to sort of increase their chances every month and those types of things. But then I also see a lot of people who are getting to the point where, it's been a year of them trying and they've never been pregnant. And maybe they have a referral to the fertility clinic. So, or maybe they're what we would call I hate this term, but advanced maternal age.
Yes, yes, not geriatric. Yes.
I know. It's way better than geriatric pregnancies. But so maybe they're just getting older like we all do. It's so they know they're not going to sort of like have as much time to mess around.
Right.
So they might come in just to see what they can do, or again, their referrals already to the fertility clinic. But what happens a lot, again, because that can feel like very much out of your control. It can be hard for people to hear, like, your only chance is to go through this really expensive procedure and hopefully it works, but we don't know. So sometimes when people hear that, they kind of want to come in and make sure they're doing everything they can to support like their egg health and sperm health and things like that. And there's also a lot of research now on certain like antioxidants that might come in supplement form, or things like that, that actually will improve chances. Or another thing that we're trained very like highly trained in as NDs is acupuncture. And that has a lot of research on improving your chances if you're trying naturally, and then also if you're going through treatment. So it kind of just depends on what people are looking for. But one thing that I will see a lot is women will come in and they're like, we're not pregnant, something's wrong with me. And when we look at the statistics on that, is it 30% of the time, it's often a female factor that's affecting chances, but 30% of the time it's the male factor, and 50% of the time it's both.
Wow.
I feel like sometimes we jump right to like, okay, well, you're not pregnant, so we're going to look at you first.
Right.
And I think people kind of forget there's like
another person.
Exactly.
Yeah. Two
people
things
involved.
Right.
Gosh, that is so true.
So I feel like when I first started working, I would rarely see partners, and now I do all the time. So
that's really
people
great.
talk about
Yeah.
talk about it a little bit more.
You shared an amazing post. It was a while back now, but I remember I sent it to a few friends of mine, and I remember saying like, can we get this on a billboard? Like, can we have this so everyone knows it? And it was you can correct me the numbers, but I think it was in every cycle, there's a 20% success rate. Like the average person has 20% chance of getting pregnant, which means 80% of us don't. Yeah. So, and I think when you're trying, you really do feel the opposite. Like you feel like you're in the 20% who isn't, and then 80% of everyone else is.
Yes.
Like you can really get that. Yeah. And I think that's like, not to say it's simple, but just to read that simple phrase and that stat, I think can really shift people's thinking, because when you feel like you're failing every time, that must take a toll, right? Like,
and I think sometimes too, it feels like everyone else, like as soon as you start trying, then everyone else is pregnant too.
Yes.
So then that makes it worse.
Right. That's right.
And again, like at school, I know like for me, I like was absolutely terrified to get pregnant, like terrified. I'm like, okay, unprotected sex.
Right. That's what we were taught. Yes. The worst. Yeah, exactly.
And then when it comes time to it, you're like, okay,
if I hadn't known.
Yeah. Right? Like
this is not easy.
Yeah. There's like 4 days out of the month that you can get pregnant.
Right.
And so, so that basically translates to any one cycle, you only have a 20% chance. And then as you age, it actually drops a bit from that, like quite a bit actually. Wow. So to the point where like if you're between about like 37 to 40, like it's more like a 5 or 10% chance every month, which are terrible odds.
Wow.
So there's quite a few factors, and really like with fertility, that age is like a big one, which nobody wants to hear.
Right.
Especially when you hang out with like super awesome, like boss women, like CEO, and you're like looking at all the stuff that they're doing. You're like, you don't have time to get pregnant before you're 35. Like,
right.
So there's all kinds of things that have been researched in those cases too, that can actually like improve egg quality for like when it does kind of like come to that. And I mean, that's not necessarily the case with everybody either. I'll have younger women who come into my office that are like 26 and want to get pregnant for the first time, and they have what's called like premature ovarian insufficiency. But basically like they have the egg supply of like a menopausal woman versus like I'll have 40-year-olds who like get pregnant on the first try.
Yeah.
So,
Right.
It's not, it's not like always that cut and dry, but it gets a little bit depressing even just like reading about like those statistics.
Yeah,
sure.
Definitely.
Have things you want to do.
Yeah, exactly. You just reminded me. It's I know it's a silly example, but when you said like when people are trying, then it seems like everyone around them gets pregnant. I don't know if this has ever happened to either of you, but when you buy a new vehicle or someone in your life buys a new vehicle, that's the only vehicle you see on the road. Like all of a sudden, like we got a van, everyone drives a black van now. Like I see them everywhere. Prior to that, I would have never noticed them. My mom got a new vehicle that day. I saw like 8 of those vehicles. I would never have noticed.
You're hyper focused on it, right?
Exactly. You just
that happened to me to the point I got in the wrong car. I can't tire.
Yeah.
And like this old man was sitting there. I'm like, oh my God.
Sorry, get out of my car.
Yeah, get out of my car.
Saint Femme has been crafting award-winning wines from the warmth and beauty of the estate vineyard for almost 30 years. Overlooking the beautiful Avon River Valley, Saint Femme's winery celebrates the coastal terroir that has been coaxed from the earth, the sun, and the vine that root the winery in stunning Falmouth, Nova Scotia. Inspired by the impressive history and winemaking tradition at Saint Femme comes the newest addition to the lineup, Lost Belle by Saint Femme Wines. The trio of Lost Belle wines includes Rosé, Saval, and Baco Noir. The fresh look and flavors of Lost Belle set them apart from the competition. Shop on site or online for the complete wine profile, as well as unique, locally sourced items. Saint Femme ships Canada-wide. saintfemme.com. www.st-famille.com.
We had a lot of questions around hormones and balancing hormones and what that looks like. And I think it's something that literally affects every single one of us. So can we shift the conversation to chat a little bit about that?
Yeah, totally. That I find is something that I see probably at least like half of my day. So, and it can be like people who aren't even kind of thinking about babies. A big chunk of people, it's like postpartum. And again, like postpartum is not necessarily like, oh, it's been a year since you had your kids. It's like once you had kids, and everything just went to like
forever after
went to shit.
That, yeah, literally. So that's pretty common. And I think a lot of the times when people come into my office, they'll be like, I have too much estrogen and so I have acne and I can't lose weight and my hair is falling out and all of these things, which again can be like a really common thing you'll sort of see online, or if you do like a little bit of Googling. But oftentimes it's not even just like our reproductive hormones. So sometimes it is that they haven't sort of like shifted back postpartum, or, you know, maybe you like breastfed for a while and they're not quite kind of recovered from that. But oftentimes too, what will really play into it and sort of the things that impact our reproductive hormones the most. So like, these are just what are going to cycle every month to give us a period, is actually like our stress hormones too. So a lot of times we have to kind of look at those as well and see what's happening. So a lot of times we'll look at like blood work for people a lot just to sort of see where they are. But
I was going to ask that, like, how do you check? I mean, that's maybe a silly question, but how do you check people's hormone levels? How do we know what our hormones are saying? Like, is it blood work?
Yeah, blood work's the best way to do it. There are other ways, but blood work's the most accurate. And interestingly, that they need to be checked on certain days of your cycle. So for them to be accurate. Yeah.
Interesting.
So sometimes people will come with blood work and they'll be like, oh, my progesterone is perfect. Or my progesterone's terrible, but it was checked on the wrong day. So it's actually like not giving us any information.
Interesting.
And the other thing that I find happens, especially for women who are like early 30s to like early 50s, is if your thyroid's not working properly. And that's something that more affects women than men, like way more. And so that actually will play into affecting your estrogen and progesterone as well. So there's like quite a few little hormonal kind of corners of your body we like to look at with that. And then there's some conditions where it's actually probably not going to show up with testing. So one of the things is PMS. So PMS is basically, or how severe that is basically depends on how sort of sensitive you are to your own hormonal shift. So that could be like Sarah and I could have the same levels of estrogen and progesterone and could have like vastly different PMS symptoms.
Interesting.
So that's probably the biggest one, like the one that comes to my brain that like wouldn't show up. Most other things would. But yeah, usually we would look at that. And then there are some kind of like general things that will affect hormone status, or that like most of us could be doing like to help make sure we're supporting our hormones as best as we can. So one of the biggest things is actually like pooping. So that's actually how we get rid of hormone like breakdown products. And so that can be a problem for people if they're chronically constipated.
Right.
Yeah. And then making sure we're sort of getting like the building blocks to these hormones. So like if we're not ingesting those, then we're probably not making them efficiently. So the biggest thing, and this is where like, I don't want to generalize, but I will for a second, is like all women suck at this, is like eating enough protein. Most of us don't do it. And that's typically like a big one. And the other thing that's a backbone for all of those hormones is vitamin D. And so
I'm so bad to take.
Just started taking vitamin D.
Yeah.
Very adulty of me.
Amazing, right? And that, interestingly enough, is like chronic vitamin D deficiencies are linked to a lot of hormonal conditions too. So like that can be a huge issue with endometriosis and PCOS and things like that. So that's a really important one too. Also, energy wise and circadian rhythm wise, that's the first thing we did in this house this morning with the early wake up time.
That's right.
Hit the vitamin D hard,
right,
in the morning, because it actually, essentially, it would be nice if we lived somewhere really sunny and hot at 7:30 in the morning. But here today it was like -10. So ideally we would go sit outside and get a little bit of that sunshine on our face for like 20 or 30 minutes. But that doesn't happen here without like a toque and a jacket. And so like our skin's not
getting
any exposed. Exactly. And then even in the summer, like mostly we're like completely slathered in sunscreen, which we need to, but also we're probably not getting very much that way. We get a little bit, but that actually will give us like quite a big boost in energy. And so
I feel like I'm gonna go guzzle the baby DDs, the baby D drops, and I give Logan like baby D drops every single day, and I don't ever take anything for myself. Like, classic mom, right?
Oh my gosh, 100%. Yeah, and so that's like super important, even timing wise for our hormones. So like when we're letting our body know, like, okay, it's morning time, like here, this is what we should be doing. And all of those hormones can kind of start on their little 24-hour cycle, because we aren't, again, able to do like, or we go immediately and get in our car and drive to work. So we don't get any vitamin D. Whereas, you know, however many hundreds of years ago, you just like go work outside. So you'd have all those like stimuli.
Is the amount of vitamin D in a multivitamin enough, or do you recommend something totally separate?
Usually you need a little bit more. Like multivitamins usually going to kind of give us the baseline so that we like don't die. Or like,
noted. Okay. Multivitamin.
Nutrient deprived. So like I love a good like multivitamin for the old men who come in my office and they're like, oh, like they're like 70 and single, or their wife passed away and they like only eat Hungry Man dinners. And I'm like, okay, you need a multivitamin.
Right.
Because you're going to get scurvy. But usually for most of us, we need a little bit more.
Oh my God. Okay. Good to know.
I feel like
pick up vitamin D tomorrow.
Yeah. I'm mind blown because and maybe I'm the only one who doesn't know these things. I'm just learning so much, but I don't ever really eat with my hormones in mind. Like I eat with like, okay, protein and, you know, you're getting your carbs,
with like
and I eat with energy.
Yes.
And when I was more like active and running and playing sports, like I was very aware of carbon up before the game or what, all those things. But which I don't even know is what you're supposed to do. But anyway, that's what we did. But now like I don't eat with hormonal balance in mind. So I don't even think
and you probably eat like sandwich crusts and like crackers
fishes
like,
off my floor. Yeah. But I guess I didn't even realize that's where I was getting hormone support or hormones from was food. Like I don't connect those.
I just thought your body
vitamins maybe, but not me too, Jess. Like I wasn't thinking of me consuming hormones.
Totally.
Yeah.
Well, you need all the building blocks for like all of those things. And so if you're not getting them, the other thing too that will come into like major play with like hormone balance as far as like our period goes is with stress hormones. Like if you're burnt out, which like again in the last 2 years, like who's not?
Right.
I'm waiting to meet that person. I still haven't. But if your body is prioritizing making other hormones, it might not be prioritizing making these things that are going to regulate your cycle. So if you're chronically stressed, that sort of puts us in a life-saving mode. Like I have to do everything right now to just like live to tomorrow.
Right.
And so this is also a common thing we need to look at when it comes to making babies, because if you're like really, really stressed, like you're not going to make a baby.
Right.
Like, you don't want to have to be responsible for another thing. Like you can't even be responsible for yourself.
That's like,
so yeah,
your natural response. Wow. Yeah.
I am literally here right now booking a discovery call. I'm like, my body is fighting for its life.
I know my appointment is on the end of the month and I'm literally like have a list now of things I have to mention.
Here I go.
So that is a vicious cycle, Anna. Like you're stressed out because you're not getting pregnant, but also you're not helping yourself because you're stressed out. That's adding to the issue.
And then you do the thing where it's like 4:00 in the morning and your eyeballs are like, oh my God. And like, then you're not sleeping enough either. So like even that can even play into like how you're producing like sleep hormones too.
Right.
Or if you're producing your stress hormones at the wrong time of the day, then it can wake you up at night. And that's really common too with like people who have kids, because you know, when you're like late 20s and whatever, you like wake up because you're like, oh, I have to pee. And it's like, not the end of the world. You just kind of like roll over. You're like, okay. And then you get back into bed and you fall asleep. But then when you have kids, or, you know, puppies and cats can be like this too, especially when you first get them, you're now waking up to somebody else screaming.
Right.
Which is going to give you not like that little like roll over and like your bladder whispering like, hey, Anna, like get up.
Right.
Now, like you're jumping out of bed and you're having cortisol response. So I don't know, like, I know for me, I would struggle with that because then it would be like everyone else in my house was asleep and I'm like, well, I can't go to sleep now.
Yeah. Yeah, exactly.
Having an like anxiety attack and like all of my cortisol is pumping through my body.
Right.
And then I'd be like, oh, I wonder like why my period didn't come back yet, or whatever. And it's like, okay, you're sleeping for 4 hours a night. Like
makes sense. Everything makes so much sense now.
All
the
of these
3 years of my life are
hold,
just really, really coming together here. I understand.
I want to see if we can like move into this piece where we're talking about like stress hormones, but like I have a lot of anxiety. I'm currently in therapy, like with a counselor, and it's great with like strategies in terms of like my mental health. But I'm like, okay, now that we're having this conversation, I'm like, so there is things I can be doing for my physical health too, that could help, you know, it's all, I'm sure all part and parcel. So, like, is there things that like people can be doing in terms of their physical and mental health to support that piece through like nutrients, lifestyle changes, food? I mean, I know I need to do all of these things, but I find that very, very difficult. But just the way that you're like that you're saying things, it makes so much sense, right? Maybe that's just what I need, like someone to like speak in like normal terms and not have all of these like extra fluff around it, you know?
Totally.
So like
And I feel
vitamins
like-
and nutritional
yeah.
support, Jess? Is that what you mean? Like what?
Yeah.
Yeah.
Or like just, more so. Yeah. Food too. I mean, I know that I should eat more salads, but like,
sometimes too, it doesn't even have to be like that complicated. Cause again, like I have a kid and I work and like I have a husband around here somewhere and a dog and all of those things. So like sometimes you're just like in the drive-thru at McDonald's getting French fries and whatever. Like that's another thing. I feel like, you know, you can't get too bent out of shape about these things because I'm sure we all ate like McDonald's French fries off the floor of our car when we were 4 years old. And we're
Definitely.
all here. Like,
Yes.
doing that is not going to hurt anything. But also sometimes it's just not practical to come home and like cook a big like 3-course meal and things like that.
Right.
So that's the other thing I really like about naturopathic medicine is like there's a lot of things where we can just like make it easy. So it doesn't necessarily have to be like, okay, no more caffeine, no more alcohol, no more gluten, no more dairy. Like that rarely ever happens in my
I feel like be like, well, what would you eat then? Like,
yeah, exactly. Have fun going out and finding unfrozen grass or something on your lawn.
Yeah.
So the biggest thing I find with anxiety is that like sometimes there also can be a hormonal like issue with that. Rarely is it ever like what we would say is like the root cause. And that's why it's so important to be like going to therapy, going to a counselor, working on coping skills and things like that. Because if you're not, then it's not going to change. So that's really like the bread and butter. But sometimes, and what's a common thing I'll see with women in my office is they might have really low iron. And having low iron can give you very similar symptoms to anxiety or can be making it worse. So if that's the case, like, is this as simple as like, oh, let's just get you on like a good iron supplement that doesn't hurt your belly and is easy to remember to take? Or maybe we can even do this with like some food and whatever.
Right.
So there's sometimes like small things like that. Thyroid's another one that if there's an issue with your thyroid that's undiagnosed, that can really make anxiety worse. But then also there are kind of like the cornerstones of like, are you eating? Are you sleeping? And those types of things. And one of the things I find to be huge with anxiety, especially in women, is like it oftentimes is a blood sugar thing. So again, a lot of times it's like we're not eating enough.
It doesn't surprise me.
We're we're going really long periods of time between eating.
And then ravenous.
Yeah, exactly. And then you eat something really stupid, like like just like leftover Halloween candy or like leftover Christmas stuff, like while you're making supper, which is fine, but your body probably had like a totally different like hormonal response in that like 20 minutes of you like shoving your face full of food, like while you're waiting, like while you're cooking supper or whatever.
Right.
And sometimes like I don't really make anything that's like super complicated, but like my husband jokingly will call me like the high protein queen. He's like, oh, Anna can make anything high protein, which I will. Like I will eat insane things. Like sometimes people at my office are like, what are you eating? And I'll just be eating like leftover turkey meatballs that I like made for my kid or something that I'm like, well, this is protein. And I have 5 seconds between like people switching in my chair. Or even just like figuring out like what to look for on like pre-made stuff or pre-packaged stuff that is like, this is the perfect thing for you just leaving your desk or leaving like the console of your car, or whatever that's gonna help when you do have to like literally pour things.
I can't even tell you how relieved I am to hear you say you were eating turkey meatballs and not like quinoa, black beans, because like that. I can handle turkey meatballs.
Keep it simple. Yeah.
I can't handle the black bean quinoa salad. Like that's you know.
And I feel like that's what a lot of people like sometimes in like the era of like Instagram and Facebook and social media, like it's so awesome. But then other times you're like, I can't like sprout like grains.
Yeah, I'm so inadequate. Yes.
Like I can't do any of this stuff. Like again, like I'm gonna be like going through a drive-thru or getting goldfish or eating whatever the like 3 raisins left
Practical,
over
yeah.
in the thing that my kid threw on the floor.
Yeah.
But yeah, a lot of times it does not have to be hard at all. Or even like tracking. I'll have a lot of women who come in and they're like the era of like Weight Watchers or like those types of things. And they're like, I put everything I eat into MyFitnessPal. I'm like, we don't need to do that.
Right.
That's just also more pressure of
torture.
like, now you have to sit down after you eat and remember everything that was
Yeah.
and like,
Takes the joy
what's
out
that
of it.
telling us? Probably
Yeah.
nothing.
Right.
Mm.
Right.
Yeah. And then you're just going to not put in the chocolate bar you like shoved down your throat because you feel bad about it. So you're like, if I don't put it in, it didn't happen.
It didn't happen.
Right. Right. That makes sense.
When you need that chocolate bar.
Right. I find it so interesting, the connection between hormones in women and anxiety as well. A few years ago, I was going to therapy and it was, I think everyone should all the time. It was the best thing ever for me. I think it took me longer to get there than it should have, but I was definitely I was having anxiety and like depressive mood disorder. Is that it? So like she would say it's not depression, but you're in a depressive state. Yeah. And when we looked at it, we were talking about, we had went through a period of losing a number of our friends and we experienced grief in our early 20s. And she explained it to me, her and my doctor, that it was like your levels got knocked out basically. So you're just like, if your gas tank was full, now it's on empty. So you're working overtime to try to get it fuller. We just have to fill that up. So therapy was a huge help. And near the end of it, made some progress, but she said, I thought maybe we'd be somewhere different than we are. And maybe medication is the next step here. And literally we, fulfilled the first like low dose prescription. And like 2 days later, I found out I was pregnant. So instantly I was like, okay, I think I want to stop taking the medication, but what happened is when I was pregnant, like, it's like my hormone, does this make sense? I guess is my question, is my hormones totally changed and I never felt better for like, in a period of the last like 10 years, I never felt better than when I was pregnant with my first child. And it's like it refilled that gas tank naturally. Like, I don't think it was the one half a tablet I took that one day. Like, I think it was my natural hormones, right? And I remember poor Pat, my husband, so sweet. I remember meeting him and telling him like, okay, I'm starting therapy and blah, blah, blah. And he's like, is it me? Like, why now? And I'm like, well, yes, it is you, because I know that I want to be better for this, because this is it, like, I know I should have went 5 years ago and I didn't. So yes, it's you in a good way. You're not making me go there, because of you. But yeah. And when I was pregnant, and I would talk to my doctor throughout it, because then I was really aware of like postpartum and was I susceptible to that because I had this and et cetera. And, I think no, like there's no, maybe, well, I don't want to speak for the medical field, but what they told me was like, no, there's no real correlation. Maybe you will, maybe you won't. But just because you've experienced this doesn't mean you definitely will have that. I never did experience that, but I was always amazed at the complete shift I felt hormonally. Like, I never felt better. I felt like I was more rational, that like overall anxiousness. Sure, I feel anxiety sometimes, but I wasn't in that constant anxious state. Like, it wasn't.
And a lot of times it's a little more like
days.
Situational too. You're like, oh, maybe I'm a little bit anxious about the fact I'm like gonna bring a kid into the world.
Yes, exactly. It was
versus
more
like,
it was more logical. Like, I felt. So then since then, I've been very aware of it. And I feel like throughout my pregnancy with the twins, I felt very similar, like different challenges physically, and hormonally. So I feel like that filled my gas tank back.
Oh, totally.
To go back to that metaphor. Is that true? Like, could that have happened naturally?
A lot of people say that. And the other thing that's happening when you're pregnant is that like you're hormonal in a new way, but you're also not cycling. So sometimes that can be really helpful because you're just like
leveled.
Staying very like, So what happens, like, and you guys probably know this, but we'll just like do a quick recap. But like what happens with your menstrual cycle is in the first half of your cycle, you're kind of estrogen dominant. Estrogen is a bit higher than progesterone. And that purpose is to kind of like stimulate the eggs in your ovary and to thicken your uterine lining and things like that. And then after you ovulate, your estrogen will drop and your progesterone will get really high. And progesterone's job is to basically grow the baby. And in the first 3 months of you getting pregnant, you actually, about 3 months, usually 10 weeks, you don't actually even have a placenta yet. So the baby or babies or whatever are depending on like your own production of that. And so it's just like your progesterone factory. You're just pumping it out. And then when the placenta comes, that's its job. So you're not getting that fluctuation anymore. So for a lot of us, like even that makes such a big difference with mood and anxiety. Because it's not that like up and down roller coaster. And this is another thing sometimes too, that can be like really hard to explain to like male partners, because their hormones all operate on a 24-hour cycle. Whereas we have things that go in 24-hour cycles. Like for instance, like off the top of my head, like melatonin, which makes you sleepy, that peaks every 24 hours. But then we also have these random things that peak every like 30 days, 28 or 30 days ish. So we're kind of operating on two separate cycles. And so that can impact like day to day, week to week, and things like that, like how all these other hormones are working. And so sometimes that's a thing that they really don't understand. Understand at all.
Well, it's so interesting that you say that, because like my husband always makes the comment that I was the happiest I ever was when I was pregnant, in terms of like my anxiety was at the absolute lowest it's ever been. I was calm, cool, collected. Not that I'm like, like, I don't think I'm super up and down, crazy. But he was just like, I've never seen you just so content and like happy. And he says it all the time. And I'm almost sometimes offended to be like, well, like,
what are you trying to say?
Like, what you're left with here. But when you say
can't
this
just
now,
be popping out babies.
When you say it now, no, God, no. But when you say it now, it's like, okay, like this obviously means that there's some stuff going on with my hormones, and
and like your body's reaction to it.
Yeah,
so interesting.
So very looking
and a lot of
women
will say that too. Like even when they're like menopausal, even they'll say like the best I ever felt was when I was pregnant. And the other thing too is like with like autoimmune people who have like autoimmune conditions, which also can affect your hormones, like they will go into like remission or not have symptoms when they're pregnant.
Wow.
Those so little really angel babies.
Wow, that is fascinating.
Yeah.
They're in us for 9 months and they're like, I got you, like you're helping me grow, so I'm gonna be really good to you. Yeah. And then they come out in the world.
Then when they come out, they're like,
job's done. Put my time in.
Get ready.
Yeah, that's right.
18 years of your life.
I'm gonna take my house out and then good luck.
Yeah.
Here I come in my house. Bye.
Anna, you mentioned vitamin D. Is there any other like vitamins or nutritional supplements? And I know this is, probably unique to people, but generally speaking, if we're talking about like 30-something-year-old women, what else should we be taking with our vitamin D every day? Or in
that's
the
a good
regime?
Question. Yeah. I feel like it depends on the person, but vitamin D is like the big one that I will kind of recommend for like most women. Again, especially in that like 20 to like even 50, we'll say, range for sure. And especially if you live in Nova Scotia.
Or where the wind hurts your face. Yeah.
Literally.
You need to take some VD.
100%. And then the other one a lot of times isn't even necessarily like supplement. It's not necessarily a supplement, but is protein. So like, I'm not a fan of like tracking nutrient, like macros, like I said, sometimes, but like for the general person, I'm not. And again, like who has time for that? But that is one thing that I usually will get people, women especially, to get a baseline of. So typically this is me just tracking it for like a day or two to see what you're getting daily. Because this is another thing I feel like we don't really talk a lot about, but once we hit 30 as females, our lean muscle mass will decrease by like 3 to 6% every decade. So we can lose a lot of muscle mass between like 30 and 60.
Wow.
And this is where we house like a lot of the things that we like. So the biggest one being our metabolism. So this is something like a lot of people will complain about. Again, maybe it's not when you're 30, but a lot of times when you're 40, they're like, oh my God, I hit 40. And like, this is happening, or I feel like I have a spare tire or bingo arms, or like all of the terms people say when they come
Bingo arms.
into
Never heard that.
Oh my God,
before.
you know, like
Yeah, I
Yeah.
know, but
So that's like a huge part of maintaining metabolism and bone density and all of those things that are really important for like general markers of health as we age as women. And the two things that have the most research on maintaining that is eating enough protein and like strength training.
Wow.
And so I use myself as an example for this all the time. So ideally you want to get like at least 100 grams of protein a day for women at least. And I was like, oh my God, I definitely do that. So I got my Fitness Pal on my phone for like the weekend, and my husband was literally making fun of me. He's like, you suck. And I was like, I do, because I was maybe getting like my best day was like probably 75 grams. So I was like not getting there at all most of the time. And again, I don't track this regularly, but then all I did was just get track for 2 days where I was like hitting the targets.
Right.
And I was like, oh my God, this is what it's like to have energy. That was the biggest thing.
I'm so intrigued. What does that feel like?
So I was like, oh, is this what you feel like when you get out of bed in the morning? Because this is not what I feel like.
Right.
And so which again, like that can come in a form of a supplement if it has to. And I'm a big fan of like good protein powder for sure, because again, you can turn anything high protein if you can throw like a scoop of protein into it. And it totally change your day. But I find that's another one. And again, like where that is the backbone of a lot of our hormones is like hugely important to like make sure you're getting basically.
wow.
Can you give us a quick example of what 100 grams of protein a day would be? Like, is that a breast of chicken? And like what's an easy way to get 100 grams of protein?
Yeah, having some chicken breast around is usually really good. So yeah, if you end up getting like a whole chicken breast in the run of a day, so maybe that's like for some people would probably be a lot to like sit down and do. Like sometimes you just don't have the appetite for that like after work, but that would help even like divided. I find the biggest thing that people aren't where they're not getting it is in the morning. And this is a lot of times like the best time that you can be like building muscle if you work out in the morning, but also balancing your blood sugar, because that's what's going to last you for like the rest of your day.
Right.
And so people are always like, I don't like smoothies, which is fine, but it can be even as easy as like what I do a lot. And again, with like a toddler is like, I just take protein powder and put it in Greek yogurt. So you take it from being like 10 grams to being like 45, and then half of your day is almost done.
Wow.
So just like easy things like that. Or if you're like a snacker at work, or you usually would have that like, in lunch, like with your lunch or something, like if you would eat like a little bit of like yogurt and granola and some fruit or whatever, you can like massively change like how you're going to kind of feel in the afternoon. That by like doing that. And again, it's like, you're not cooking anything. You're literally just taking something out of your cupboard and mixing it in something out of your fridge.
Do you have a favorite protein powder that you can recommend? That doesn't taste like chalk?
I use one that's not flavored because I don't like that either. I use one here and it's Cytomatrix is the people who make it. It's just unflavored whey protein. But I know you guys are in Cape Breton, and I know that lots of people who listen to this are. So Allison at Leaf and Root, she has all kinds of really good ones depending on like what you're looking for. So if you are vegan or vegetarian, she has lots of really good options for those. But if you did prefer something that's like whey protein or like a dairy based protein, she even has like animal based protein. So like beef isolate for people who might be like keto or eating like paleo diets and stuff like that. So she's like really helpful.
That's good to know,
she'll
because
be able to give you the lowdown on taste and texture.
Yeah.
I always wondered if that was recommended or healthy. Like I feel like I'm like a non-interventionist in a way that I'm like, just regular things. Like I never know if powders and
Yeah.
proteins and supplements are like actually what you should be doing for your health, or if it's like a marketing scheme to like make
And
us buy
sometimes they
things
are
to get
like
us things.
sometimes,
Like,
yeah, sometimes people will bring things in and I'll look at them and be like, there's not really anything in this.
yeah, like I don't know
Right.
enough to know if I'm getting duped or if this is the actual thing I
Yeah.
should know. So
Yeah.
it's nice to have a resource, like you said, Allison, like knowing,
Yeah.
going to someone who knows what they're doing.
Yeah,
Can
exactly.
help you in that.
And she can give you things that, you know, only have one ingredient, which is like the one
Right.
I have. It's just whey protein. There's nothing else in it.
Right.
So yeah, that can be really, really helpful. And she's awesome. Or yeah, anyone who's listening, just DM me on Instagram or Facebook and I can give you, I have a whole list.
Amazing.
But yeah, they're all texture and smell friendly. Sometimes they smell funny too.
I know.
That's good
Why
to
do
know.
they got to be like that?
I know,
No.
making it hard. I know that you offer lots of other services, Anna. Just like a quick snippet, maybe to let people know, you know, you mentioned acupuncture is one, botanical medicine was highlighted on your website. IV and injection therapy is really interesting to me. So who would you say that is for? Like what does
I see lots of people for IV therapy that have like digestive issues. So it's basically just it's not crazy high doses of vitamins or minerals or anything like that. They're normal doses. It's just a really efficient way to absorb things.
Okay.
So people with chronic digestive concerns are typically bad at absorbing things from their food.
Right.
Because there's inflammation or all kinds of things happening to their digestive tract. So I'll do that a lot, or oftentimes with like burnout too, or if there's something happening where they're requiring like more specific nutrients, we'll do that. And same thing with injections. So depending on if people have like low B12 or things like that, that can be a really easy, like efficient way to get your levels up.
Yeah,
for sure.
That's good to know. It's good to know that resource, right? Is available.
Yeah.
We are cognizant of your time. We know that we've been chatting a lot about different things, but we did have a couple other questions. So can you touch on ear seeds?
Yeah. What are ear seeds? I'm dying to know.
So they're commonly used in Chinese medicine and acupuncture. They basically are little tiny, they look like really small band-aids with a little like surgical steel like ball on the bottom. That would be like about the size of the end of a pencil. So it's really tiny. And they stick on acupuncture points on your ear. And so they stimulate certain nerves or nerve endings to kind of give us like a desired effect. So a lot of times we'll use ear seeds. The most common things I use them for probably are anxiety. So there's a couple acupuncture points in your ear that can be really helpful for calming you down.
This is going to be me for like,
yeah. And you just leave them in there and they just oftentimes will fall out after a couple showers. But it can kind of give you the effects of like an acupuncture treatment for even longer than kind of like the 45 minutes you're in a room or whatever. Cool. Or there's other things that I commonly use them for too. Another one is for people who have issues with bladder frequency. So I see a lot of, again, women, this tends to affect women more than men, but like interstitial cystitis. So that's kind of a bladder condition that will make you pee a lot, or sometimes like you pee and you don't totally empty your bladder, or you have like a lot of like irritation. And so they work quite well for that too.
Wow.
Randomly.
A spot in your ear. It's just fascinating to me.
And they can go other places. So that's kind of another common thing we'll do with fertility treatments is like if there's kind of points, acupuncture points we'd want to leave in while you are kind of going for your embryo transfer or whatever, we can like put them on your wrists or whatever.
So
or if you're really nauseous early in pregnancy.
Sarah.
Really,
are you serious?
Yeah.
I wish I threw up I was nauseous every single day of my pregnancy with Bo. Like literally till the moment he came out of my body, I was vomiting in the delivery room. Like
it's awful.
Oh,
wow. I'll never forget your baby shower. Like I arrived
Running
and
to the
Courtney
bathroom?
was like, Sarah just was puking.
Yeah.
And I'm like, why
Literally
is this still
every
happening?
single day. One of my
Yeah.
like biggest memories from that, because you just get used to it, is my brother-in-law and his fiance got married, and so everyone had a good time at the wedding. I was sober, obviously, but I was the only one up the next morning vomiting.
Throwing
Like
up.
everyone else
I
was like
know.
snoring away, and I was like, "This seems rude. Like, why am I
It's
the only one?
awful.
I had
Yeah.
water all night, you know."
And especially even like early on too, you're like, I don't know, I feel like you get seasoned as the months go on, which is still not
Yes.
fun because it's
Yes.
not fun to throw up with a belly either.
Right? No,
but
it's not.
yeah, early on, you're like, what is happening? And then like, how do I hide the fact that I'm like,
Yeah, my
barfing my
eyes
guts
would
out?
be bloodshot because I was busting like little
From
things in my
sin.
eyes from vomiting. That's how I knew I was pregnant with the twins. And I also said the day before our ultrasound to my husband, maybe it's twins, because, and he was like, why would you say that? And it's because I was so
Don't put that
sick.
into the universe.
Yeah, because I was so sick so early. I was like,
Yeah.
there has to be two people in here. Like, what is happening to
my
me? Because it
God.
was so soon. That's so interesting. I
enough.
wish I
That's
would have
another
known about
thing
ear
that-
seeds.
Yeah, and acupuncture, I see a lot of people for acupuncture early in pregnancy because of like
Oh, I had
severe
no
nausea.
idea.
and
I had
vomiting.
no same. I feel like,
Yeah.
we like tell them that. Like, thank
Yes,
God for this
yes,
podcast. How many people are
exactly.
suffering right now?
Exactly.
Listening to
Oh,
this,
it's so
being like,
it's
Book an
awful.
appointment. Yeah, you shouldn't suffer through that if you don't have to.
No,
Ugh.
it's terrible.
no.
Do ear seeds help with migraines, Anna? I think acupuncture does, right?
Yeah,
Is-
migraines and like certain types of headaches.
Wow.
That's
My
actually
sister
like,
should
I don't
try
know if you
this.
guys, I don't know if this is as popular, but I remember when I was in like high school and university, a lot of people will get like their tragus pierced.
Oh,
like,
yes.
for migraines.
Yeah.
Oh.
Oh.
So
Oh, I didn't know that.
I thought they were just being cool, like hip,
Yeah.
getting it done.
Well, some of them are. Some
Yeah.
of them are being cool, but some of them are for like chronic migraine sufferers. They'll like suggest
Cool.
that.
Oh my gosh, Amanda, if you're listening, let's go get that piercing done. My sister suffers from migraines. This is fascinating.
Yeah.
So
And
does my
that's-
mom. I wonder if I could
that's
talk
one of
her
the
into
things.
getting that done.
Yeah.
You might have to get like a cool
Let's take her to
earring
get
or
it.
something.
Amazing. That is so
Could
funny.
you imagine?
Yeah.
Oh my gosh. Was there anything else, Sarah, that you wanted to touch on before we get into our would you
No, I
rathers?
think let's give Anna the final word. Like, just if you want to wrap up of like, if who should be booking an appointment with you or some other services you offer, Anna. If
Everyone.
there's anything else we didn't touch on, is that
I
sound
think
good?
we touched
can lead
on
you into it?
everything.
Yeah. Okay, we'll do our like little thank you, Jess, and then we'll run into that. Jess, is
Yeah,
there any other
absolutely.
questions we missed from the?
I
There was one
think
about
just
thyroid, but
yeah, I think she touched on thyroid a little bit.
yeah.
I think too that like if you'll come again, like I think there's definitely probably another opportunity
Yes.
to have another conversation for
Yeah,
sure.
we
Like,
would
if
love
you wanted
that.
to deeper dive
This has
into
been
like one of the
amazing.
things. But one last one. So how can people find you? And is it covered under insurance
Oh,
providers?
yes, you did give me this.
Yeah.
So I usually will tell people the best way to find me is my website, which is just my name. So annadentino.com, or on Instagram, Facebook, any social media. And my email is listed on all of those. So you guys can always email me.
And we'll put all of that in the show notes as well.
Okay,
So it'll be
perfect.
accessible.
Awesome. I work in Halifax and Dartmouth. I work at Choice Health Center. And in Sydney, I work out of Fiat Physio, usually twice a month. So if anybody's booking, that's where they'll find me. But you can book through my website or like over email is usually the easiest way. And I'm not covered under MSI. So like you would usually bring your health card to the doctor or to like the hospital or whatever. But if you have extended benefits through work like Blue Cross or Sun Life or Manulife, most of those cover naturopathic medicine.
Oh,
And
great.
also my office staff are awesome. So if you're curious, they can check that for you.
Oh, that's a
Amazing.
really
That's
good
good to
idea.
know.
Yeah.
I think it's so amazing that you come to Sydney. Like Cape
I
Breton
do
is so
too.
lucky that you are making yourself accessible for that. Like so lucky. So grateful that you're doing that.
It's so fun. That's my favorite thing to do in a month. I always have like the best conversations. And I say that all the
Nothing
time.
like Cape Bretoners.
Yeah,
Right?
that's amazing. Anna,
Not to,
before
like,
we
toot our own horn, but
that's
like
right.
toot.
Toot.
Yeah, no big deal.
Before we get into our morning meeting questions, Anna, is there any final thoughts or services? If anyone's out there wondering if naturopathic medicine is for them, what would you say? Is it for everyone? Is it for certain people, certain age?
I would say it's for everyone, but I'm a little bit biased.
Right.
But if you are wondering if it is for you, definitely reach out through my website, and my office staff will save that for me. So I will answer all of your questions myself to make sure I'll give you the clearest answer and the best
Love it.
for you. If
Love it.
That's amazing. Sounds great. I can't wait. I have an appointment. I booked the appointment prior to this conversation. It's at the end of the month, so maybe I'll take everyone on. I'll go live, or I'll do a story and I'll take them on our journey and just see what it's like, and just kind of break down some of that, unknowns for them, so they feel a little bit more comfortable. Maybe we'll do that.
Yeah,
that sounds great. Yeah, that sounds so fun. Can't wait. Okay, let's jump into our morning meeting questions. We are so thankful you joined us around the table. We can't wait until our next chat to have you back around. I know our listeners will be just hanging on to every word. This was so educational and fun. People I know who have gone to Anna, they've said that, like, she just talked to me. I felt like she was my best friend, or she spent like an hour with me and we just chatted. Like, she's so lovely. That's always the response. And now I understand. Like, I feel the
me
same
too.
way. It's just amazing. I feel like I've known you forever.
I'm glad.
Yeah, so great. So thank you so much for joining us. Let's jump into our morning meeting questions. Jess, you want to take it away?
All right. These are just rapid fire. On a regular day, would you have white or red? What would your choice be?
Red. I'm a red gal.
Yeah.
Nice.
Tea or coffee?
This is a hard one, I feel like, as an ND, because I love a good herbal tea, but I also love coffee, dark as possible and black.
Okay. You're with Jill.
I'm not
Dr.
sure
Julia McMullen.
Yeah, that's
you
right.
Guys are like
right as strong and as black as I can. That's my favorite.
Yeah. That is hilarious.
We do also ask a fun, what would you rather? So would you rather lose your phone or your car keys?
Oh,
okay. Well,
I know
this is a huge problem, because for Christmas, my husband gave me an air tag because I lose my keys all of the time. So I guess I'd rather lose my keys, because I do it every day.
Because you can find, right.
Now I can find them if I have my phone.
That is brilliant.
Amazing. An air tag.
Very
like, Merry Christmas,
so
honey.
Where are some funny places you found your keys?
Usually he finds them. But I'm really bad, because then I just take his. I'm like, I can't find mine. I have to go to I'm going to take yours.
Right.
I lose those. Like a lot, they're like in the car, still in the ignition, in the door.
Yes,
a lot of those are like
in the door many times.
But I've like washed them a lot too. Like panic looking, and
that is hilarious. I'm glad I asked that.
Jess, what would you rather lose?
Well, like, I have to go to work. So I feel like I have no choice in this matter. Like, there's nothing worse
without your phone
when you're right. There's nothing worse when you're panicking in the morning. You're trying to get your child out the door. You can't find the keys. You got to be at work. You got to do the day. Like, it's the mad dash. Like, can you just picture it? The sweat, like, under the pits. And you know?
Yeah.
So I'm with you, Anna. Like, I can do without my phone. It wouldn't be fun. I feel like I'd be calling the daycare every 5 minutes. Is he okay? Is he okay? But okay, I'll go. I'll go. Yeah, I know, but I don't. That's true. That's true. That's true.
It's hard. That's a hard question.
Yeah.
What about you, Sarah?
Well, it's funny because I lose my phone 1,000 times a day, like so much so that Patrick put it in his wedding vows. I don't know if you remember that, Jess, but he said, like, I vow not to panic when you lose your cell phone 10 times.
Oh my God, that is funny.
Because he's always like, is it in your pocket? And I'm like, oh yeah, it is. Like just yesterday morning, I'm like, stop, I forgot my phone. He's like, check your pocket. And it was in my pocket. So I lose that often, but a few weeks ago, we lost the van keys, and Patrick, I was like, Pat, you moved the van. You came back in, and it was the day of the big snowstorm.
Oh my God.
So I kept saying, did you have them in your pocket when you went sledding with Bo? And he was like, nope. I put them in. I took them in the house. I know I put them in the house. I'm like, okay. So we spent days looking for them, couldn't find them. But he was very panicked about it. And I was more like, well, we have an extra set. Like, it's fine. I'll just take this extra van key. He's like, but do you know, because it's like the start or the lock one, like those little buggers are expensive to replace. So he was like, no, we have to find it. Anyway, it rained like a few days later. And I was like, just take a gander in the backyard. He found them at the back. Our backyard's like a little hill. That's where we sled. Found them in the woods at the back, in the backyard, underneath all the snow. So he did have them in his pocket when he went sledding.
Feels good too.
And there they are.
Yeah.
Yeah, exactly. I've left them in that front door a few times too. But yeah, I think I'd rather lose my phone if I didn't have an extra set of keys. I mean, you need your keys. That's like panic stricken.
I am concerned though, because like, you know how like the mom finds everything? You know, when you would lose something as a kid, you like ask your mom and she would know where it's at.
I am that
like,
person.
I don't know where stuff's at.
Yeah.
And I'm the mom. So like, what happens now?
Who helps
Like,
me?
what do we all do?
Yeah.
Get an air tank. Get air tanks.
Yes.
For the
Yeah.
things.
Air tanks on everything. Jessica will just be sticking them on
My
Logan's
toddler.
forehead.
Like,
Yeah.
I put one in my husband's wallet.
I love it.
We've been like talking about putting one on our dog, but like he's not that bad. But my sister's dog escapes all the time, and I was like, you should just get one for her.
Right.
It's
My
super
husband
convenient.
needs one for his wallet. Like if I hear once, like it's gonna break us.
Yeah.
Did you see my wallet?
Yeah.
Oh, like pain point.
Yeah.
Pain point.
100%.
Yeah.
Me too.
How do you not know where your wallet is? Like,
Yeah.
I don't understand. Like,
It's
you just
funny.
had it.
I think I am a pretty good finder, Jess. It's funny you just made that connection that like moms find everything.
Yeah.
Bo will say like, Mommy, you're a good finder. He calls me a good finder and Dad a good fixer. So I get to find everything. But it's because I like either cleaned it up or remembered where I put it or like organized it in
or
some
actually
way.
look.
Yeah, or I looked. I'm like, did you check
you
under that
spent the
pile of
time.
clothes? Like I looked. I'm like, did you pick it up? No.
Yeah, though you have to. Yeah,
Move
just
it around.
anything. Yeah.
Yeah, I took a glance, a gander. You know what? Now that we're talking more, I don't know if I could lose my phone. I feel like it's very expensive, and everything I have is on there, and my camera. I think that would cause me more panic. I'm changing my answer.
Or like the fact, like my husband loses his mind. I mean, he works for a tech company, and he'll be like, "Anna, it says you haven't backed up your computer in 649 days." I'm like, no. And I definitely don't back up my phone.
Right, me neither. Everything would be gone.
Good.
Yeah,
Yeah,
God,
Yeah,
funny.
that is very true.
Who knew that
is
little
so
what would you
funny.
rather would spark?
Yeah, that was a good one.
Yeah, that was a good one.
That was a very good one. I love it. I have a little tip for the keys. I just bought like a little tiny 3M hook, like a tiny one. You can get little tiny squares with a little hook. And I just plop 2 of those little stickies right by my door. And that's where we put our keys. I mean, I know like key hooks have existed since the beginning of time. So it's not a new invention, but it's one that's like you can take them off really easy without ruining the paint or screwing anything in. So if you need somewhere special to put your keys.
I would probably like not put my keys on there though.
Yeah.
That's what I would
I just
do.
leave it in my purse. It's an automatic start. Like I don't need to put the key in the ignition. So I just have it in my purse. And my purse is going to come with me wherever I go. So
you just can't forget your
if
purse.
I get in the car and it won't turn on, then I'm like, fuck, where's it at? Like it's not in here. Logan's already buckled in. Like,
I know. Then you're screwed. Yeah.
That's also a good way to remember your purse, Jess. Because then you're like, you have to take your purse. I went to Shoppers today, went to walk in. No purse. No wallet. Had to get in my van, go back home.
I do that a lot.
Yeah.
Like too many times. Get to all the way to the grocery store and I'm like, I have to go back.
I know.
I have no wallet. Can't pay for anything.
Yeah. I told my friend that once. She's like, why don't you just have like Apple Pay on your phone? I'm like, I don't know what that means. I need to figure that out.
Yeah, my husband's into all that stuff. He like maximizes his technology to the fullest. Like you can't like if he wants the next iPhone, like I'm never just like, oh, should you buy it? Like, cause he will use every single feature.
Right.
Like he gets his full use out of it. I'm not that person. I'm just like the basics.
I'm the kind of person
still
who
use
like,
a flip phone.
Yeah.
Oh, me too. I would put my credit card on my phone for like Apple Pay. My identity would get stolen. Like then they'd rack it up. Like that's what happens.
That's how I feel
like,
too.
All like that's never happened to me. No one stole my identity, but like
knock on wood.
Just like dumb things like that will like always. If it's gonna happen to anybody, it'll be me. Like I drive myself crazy. I'm like,
that's good self-awareness though. You're like, can't do that now. Someone will steal my identity.
Yeah, that will be the end of me. We'll be in massive amounts of debt because all my credit cards got stolen. And
stupid Apple Pay.
I don't exist anymore. Yeah.
That is so funny. Oh my gosh. This was such a pleasure. What a conversation.
Yes, thanks for having me. This was awesome.
Thaness for joining us.
This is the funnest podcast I've ever been on, for sure.
Yeah, you heard it here.
Yeah, you
What
heard
a
it here
compliment.
first.
Thank you so much. We're gonna
Oh
take
my
that
God.
sound bite
Yeah,
out
you're
and
gonna-
just play it on loop. That'll be like our
every
little-
At the
episode-
end.
Every episode, we usually have like a new quote we want to put on a shirt.
Yeah.
We're gonna
Ooh.
use that one for your
We're
episode.
gonna
Yeah,
use that
okay.
one.
This is the
I'll
first
put my
podcast-
name behind that for sure.
Yeah.
Yeah. Quote, Dr.
Love
Danny
it.
Antino. I love it. It's amazing.
Love it.
Thank you so
Yay.
much
Oh
for
my God.
having us.
Thanks
We're
for having-
already looking forward to the next one. We
Yes.
can't wait to have you
Please
back
come
around
back
the
for that
table.
for sure.
We'll see you soon. Take
All right,
care.
bye guys.
See you.
See ya.
Bye.
If you enjoyed today's episode, please subscribe to our podcast and give us a review. You can find us on social media at The Morning Meeting Podcast and connect with us through email at themorningmeetingpodcast@gmail.com. Thank you for sitting around our table. Sarah and Jess.